Atzumi, a nasal powder form of DHE, is approved by the FDA for acute migraine treatment, offering a convenient, non-invasive delivery system. Migraines are far more than just bad headaches. They are a complex neurological condition that affects over 40 million people in the United States and nearly 1 billion people worldwide. For many, a migraine can feel like a sudden storm. One moment you are fine, and the next you are in intense pain accompanied by nausea, sensitivity to light and sound, and sometimes even visual disturbances known as auras. But now a breakthrough treatment has arrived. Its name is Atzumi. Recently approved by the US Food and Drug Administration, Atzumi is an innovative nasal powder formulation that delivers fast and effective relief during acute migraine attacks, and it does so in a way that could revolutionize the way migraines are managed. Migraines typically present in two main forms: migraine with aura and migraine without aura. Aura symptoms may include flashing lights, blind spots, or tingling sensations, often occurring before the actual pain begins. Regardless of the type, migraines are among the most disabling neurological disorders and are ranked by the World Health Organization as one of the leading causes of years lived with disability. They are believed to occur due to a complex cascade of events in the brain, including abnormal activation of the trigeminal system, inflammation and dilation of cerebral blood vessels. Neurotransmitters such as serotonin and calcitonin gene-related peptide, also known as CGRP, are involved in amplifying the pain signals. This is why targeting these mechanisms is so crucial in the development of effective treatments. For many years, oral medications like triptans and non-steroidal anti-inflammatory drugs have been the standard treatment for acute migraine. However, these medications are not always ideal. They may take too long to work and can be poorly absorbed when a patient is experiencing nausea or vomiting, which is common during a migraine attack. Some patients cannot take triptans at all due to underlying cardiovascular conditions. Others may develop medication overuse headaches or find that the relief they get is incomplete or inconsistent. Injectable options can offer faster relief but may be painful, invasive, and inconvenient, especially for patients on the go. Liquid nasal sprays are another option, but they often suffer from inconsistent drug delivery and absorption due to variability in spray technique and droplet size. This is where Atzumi offers a new and improved approach. Atzumi is a dry nasal powder formulation of dihydroergotamine mesylate, commonly referred to as DHE. DHE is not a new drug. It has a long history of use in migraine treatment, but what sets Atzumi apart is how it is delivered. Developed using SMART technology, which stands for Simple Mucoadhesive Release Technology, Atzumi delivers a fine powder deep into the nasal passages for rapid and consistent absorption. Each single-use device contains 5.2 milligrams of DHE mesylate and is breath-powered. The patient inserts the nozzle into one nostril, inhales gently through the nose, and presses the actuator 3 times to release the full dose. This design is ideal for individuals who cannot swallow pills during an attack or need fast, reliable relief. Dihydroergotamine is part of a class of medications called ergot alkaloids. It acts as a non-selective serotonin receptor agonist, binding primarily to 5-HT1B and 5-HT1D receptors. By doing so, it helps constrict dilated intracranial blood vessels and blocks the release of pro-inflammatory neuropeptides. Unlike triptans, which target only a couple of serotonin receptors, DHE interacts with a broader range of receptors and has a longer duration of action. This makes it especially valuable for treating prolonged migraine attacks and those that tend to recur within the same day. In clinical studies, including the pivotal Ascend Phase 3 trial, Atzumi showed strong results. About 37% of patients achieved complete pain relief within 2 hours of taking the drug. More than 85% of participants did not require any rescue medication within 24 hours of their first dose. Additionally, over 90% of patients experienced freedom from their most bothersome migraine-associated symptom, such as light sensitivity, nausea, or sensitivity to sound. When compared to older DHE nasal sprays like Migraine, Atzumi provided more reliable and consistent absorption, better pharmacokinetics, and reduced variability in drug levels. That consistency is key for predictable pain relief when it is needed most. Atzumi is approved for the acute treatment of migraine with or without aura in adults. It is not meant for preventive use and should not be used to reduce the number of migraine attacks over time. It is particularly helpful for people who experience nausea or vomiting during attacks, for those who cannot tolerate oral medications or triptans, and for patients who prefer to avoid injections. However, it must be prescribed and used under the guidance of a healthcare professional who is familiar with the patient's cardiovascular profile and medical history. Like all medications, Atzumi has potential side effects. The most commonly reported include nasal discomfort, a change in taste, nausea, and a runny nose. These side effects are typically mild and temporary. However, Atzumi carries a box warning due to the risk of severe and potentially fatal peripheral ischemia when used with strong CYP3A4 inhibitors, including ketoconazole, ritonavir, and clarithromycin. Combining these drugs can significantly raise DHE levels in the blood, leading to dangerous blood vessel constriction. Atzumi should not be used in individuals with known coronary artery disease, a history of stroke or transient ischemic attacks, peripheral vascular disease, or uncontrolled high blood pressure. It is also contraindicated in patients with liver or kidney impairment, hemiplegic or basilar migraines, and during pregnancy. Women who are breastfeeding should avoid nursing for at least 24 hours after taking Atzumi, as DHE can pass into breast milk. Patients should also avoid using any triptans or other serotonergic medications within 24 hours of using Atzumi due to the risk of additive vasoconstrictive effects. Each Atzumi device is single-use and does not require priming. To use, insert the nozzle into one nostril, inhale gently through the nose, and press the actuator 3 times to deliver the full dose. If symptoms persist, a second dose can be taken after at least 1 hour, but no more than 2 doses should be used within a 24-hour period. Correct technique is essential to ensure proper delivery and absorption of the medication. Atzumi represents a major advancement in the treatment of acute migraine. It combines the long-proven effectiveness of DHE with a modern dry powder nasal delivery system that offers speed, consistency, and ease of use. It avoids the digestive system, which is especially beneficial for patients who experience nausea or have delayed gastric emptying during migraines. It is compact, portable, and designed for simplicity, giving patients the power to take control of their migraine quickly without a pill, injection, or liquid spray. When a migraine hits, every minute counts. Delayed treatment can make the pain harder to stop. Atzumi offers a fast, effective way to break the cycle of migraine and reclaim your day. With just a simple nasal puff, you may go from debilitating pain to functional relief in as little as 1 hour. If you or someone you care about suffers from migraines, speak with your healthcare provider to find out whether Atzumi could be the right treatment option. And for more breakthrough drug insights, expert reviews, and up-to-date explanations of the medications shaping modern healthcare, make sure to follow Drug Insight Hub. We break down complex medical topics into easy-to-understand videos and articles that empower you to make informed choices about your health. Subscribe now and stay one step ahead in the world of medicine.